Well, tell me a little bit about, actually, I'll be the first to say that you would not be the first person who has been using the Motus Hand who's greater than 20 years post-stroke. So there's been a number of people in our cohort now that have been using the devices and seeing some improvements. So you'd be in happy company there. Well, tell me a little bit about your sort of what's going on with you exactly right now. What kind of things did you do for rehab? And tell me what things are working, what things maybe didn't work.
Well, I had rehab initially for 3 months, and then they quit, and plateaued. And I've had rehab probably every 2 or 3 years. I've gone back for another stint, and it's promising, but then time is up, and I don't really, I can't afford to keep paying that kind of money.
Sure. Yeah, and that's always one of the challenges, right? With the way that the rehab system is sort of conditioned, right? It is kind of conditioned on the typical outpatient orthopedic patient when there is a classically fixed amount of time, and it's usually one epoch of rehab that you need, and then you're off to the races. And that's just unlikely to work for individuals who have neurologic injuries where they might need extended periods of rehab. And so I think your description of your experience with rehab sort of off and on, sort of spits and spurts, is very, very common with individuals that I've worked with. And actually, we have a very special guest joining us too. I may get Dr. Wolf's opinion. So Dr. Wolf is a professor here in Atlanta at Emory University School of Medicine, and is a world-renowned expert in stroke recovery. So I may get his insight into this. I imagine he would agree that that's your experience that you've described, Craig, is quite universal. Unhappily so, but it is quite a universal experience among stroke survivors. And so tell me a little bit about your sort of, you said you were seeing some encouragement. Is that you were seeing some improvements in your function and then they would just stop, or what's the case going on right there?
Well, say for example, I've tried lots of different things. The last thing I tried was you take a I don't know what the name is. It I forget what the name of it is, but I would get along and be moving and lifting my arms around and putting rings on poles and so forth, functional stuff. And I got to the point where I was getting pretty good at it, but then my time of rehab was up, and that is something they couldn't provide.
Sure.
As an at-home device. I've tried things like Raphael, but to no avail.
Yeah. I think those are really it's first of all, it's encouraging that you're able to do some of those tasks and able to get some improvement and showing progress when you're able to do it. And this is what I was talking about. There's just this incongruity between the way that people need to progress in rehab and the way that it's delivered. And maybe not delivered, for instance, maybe it's reimbursed, right? The providers, I think, given ultimate resources, they would love to continue to have you on and continue to see progress. But there's just some inconsistencies there and some mismatch in the way that rehab is reimbursed and the demands that are focused on that, or I guess put on that. And so I think, looking for at-home approaches where you can kind of work outside of that typical framework is really what drives us each day, right? We're trying to help people sort of continue to see progress by nature of having therapeutic approaches that can be accessed in the home. And I think these home-based approaches are going to be the way in the future because there just aren't enough therapists out there in the world, nor will at present the U.S. healthcare system does it kind of work in. So I think you're very much in the right mindset, trying to find something that can help you continue to see progress for the long period of time. So I think you're very much in the right sort of track there. I maybe just ask Dr. Wolf. I think you have been listening on to this conversation with Craig, and I just wanted to see if you have any additional thoughts. And I wanted to formally welcome you on to the Rehab Power Hour. So it's great to have you here.
Thanks, Dr. Halsey. Hi, Craig. I admire your perseverance and your willingness to keep on trying over these 20 plus years. It's very admirable. Not everyone does that. And this notion, this idea that we've become very stable and can't show any more improvements probably is not true in many cases. And what one's constantly trying to do, as you are, to find new ways in which you can kind of tweak your brain a little bit and get some changes or improvements by an interface, by connection that you might not have tried before, or was not really as well developed in working with you as it might be. So that's what I have to say right now with respect to the interfaces, the components that the Motus folks have. There are some very creative options that involve gaming goals that are related to improving your movement, which may wind up activating your brain or certain nerve cells in your brain in a way that may not have been optimally tried before. And therein lies the potential, the hope that one can gain from these kinds of experiences. So I'm glad you tuned in this evening, and hopefully you will learn a few things that will be encouraging to you.
Mm-hmm. And Craig, what kind of questions, in the interest of your time and being very respectful of your time, what kind of questions do you have specifically that I could help answer?
Well, as far as I realize that the pricing structure, they charge $400 a month and whatever to for the supplies, and I would like. I guess I have to figure out whether or not it's going to work.
Sure.
On me,
Yeah.
Before laying out money.
Yeah, and Craig, I think the decision making that you're bringing up is an important one. It's an important calculus that each person needs to make for themselves. And I think my role here is to help provide some information for you to make an informed decision based on all those other vectors that I can't help measure. I can talk about the science and the efficacy and the safety and how it kind of works and all these things. But then what needs to happen is that needs to be integrated into your decision making. And you're exactly right. There is a cost to this. We are not trying to skate around that. We recognize that, and we're trying our best. And we've done a lot to reduce the cost of the $20,000 robotic system down to something that's more accessible, but it is still a cost, and we recognize that. And we're continually trying to push that price down. We're just not quite to our goal yet. Let's put it that way. But in terms of that decision making about where those vectors line up about the actual costs and the effectiveness, that's really only a question that you can answer. But in terms of the efficacy, we know from the studies that it is been shown or has been shown to help individuals improve their range of motion, their strength, and their function. And these capabilities were retained, which is really important. And so I think, if you were to ask me exactly how much would Craig improve, I cannot give you that answer because science talks on averages. And so the best I can do is say generally stroke survivors see these types of improvements at this time frame. My old metaphor here is that I've got a crystal ball, and I would love for my crystal ball to be perfectly clear, But unfortunately, in mine, based on the way that science works, there is some cloudiness in it. And so there's some imprecision in my ability to tell anyone, regardless of any sort of details I can get about them, about the sort of magnitude of improvement that they're going to see. But generally speaking, we see what are called minimally clinically important differences. And this is a fancy clinical term, but really it means, would it be something that I could see a difference, or you could see a difference? Meaning, could you do a new task that you couldn't do before? Or is the magnitude of improvement such that you would be able to perceive it? And we see those types of changes around the kind of 3-month mark. That's after about 5 days use, about an hour and a half a day, 5 days a week. So it's a non-trivial amount of effort in terms of the amount of rehab that is done, but the outcome of that is generally very positive across a wide distribution of stroke survivors that we've looked at.